So now we had seen about the various forms of chronic inflammation and granulomatous inflammation as well. Let's move on to the final part, which is the tissue repair. So the final R was repair. So we had already seen about removal and regulation of inflammation, right? So after that, the repair process should come. So only then the tissue will come back to its normal state. So the process by which the restoration of the normal architecture and the function of the cell is regained is called as repair. So repair happens with two mechanisms. Firstly, with the regeneration of the lost cells, and secondly by scar formation. So for regeneration to happen, what should be there? The supporting structure of the organ should be intact. Only then upon it the regeneration can happen. While if the supporting structures are not intact, it will lead to scar tissue formation. So regeneration can take place only when the cell is capable of division. So it can either develop from the proliferation from a differentiated cell type or from stem cells, like stem cells or progenitor cells. So for progenitor cells, an example will be an oval cell. So oval cells, you see it in the liver, exactly where in the liver? In the canals of herring. So these are the ones which cause the regeneration of the liver once the liver has been cut off or resected. Okay, so oval cells are stem cells in the liver. I suppose this regeneration of the cell is going to happen from the differentiated cells. You will have to know about the type of cells. So we have labile cells, stable cells and permanent cells. Labile cells are the ones which are continuously dividing. Labile cells will divide continuously. And the examples of this will be gastrointestinal tract, bone marrow, so the mucosal areas. So here even the urogenital tract. So here it will be continuously shed and it will be regenerated. So for that the cells have to divide. So these are examples of labile cells. Then stable cells, they divide only in response to a injury. So example will be liver, kidney. So liver and kidney tissue, when there is need, it can regenerate. They have some amount of potential to regenerate. Then permanent cells, they cannot divide. Okay, they cannot divide. And examples of this will be neurons and cardiac cells. So cardiomyocytes cannot regenerate. So that is the reason why neurons cannot regenerate. So what happens during tissue injury is that whenever there is a tissue injury, so obviously inflammation will start happening, simultaneously coagulation cascade will be activated, so platelet plug will be formed and then fibrin formation leading to the final clot formation will be there. So inflammation and coagulation will happen simultaneously. So that will cause the next step will be cell proliferation. So be it an epithelial cell, endothelial cell or fibroblastic cell, all cells will be proliferating. So the epithelial cells will proliferate and bridge the gap caused by this injury. And then endothelial cells will proliferate during neoangiogenesis. And then fibroblasts will proliferate, which will lay down some collagen and form the scar tissue. So this is the normal procedure which happens. So once the cell proliferation happens, the next will be the formation of granulation tissue. And this granulation tissue is called as the hallmark of repair. So hallmark of repair is formation of granulation tissue, and this granulation tissue is composed of new blood vessels, fibroblasts along with the inflammatory cells. So this is the classical definition of granulation tissue. So the fibroblasts which were present inside this granulation tissue is going to lay down the collagen. Collagen is the connective tissue, so it will lay down collagen and form the scar. So scar is formed. Now once the scar is formed, this scar has to be trimmed to the side. So remodeling of this connective tissue scar will be there, which is going to be by certain enzymes called as matrix metalloproteinases. And to inhibit this matrix metalloproteinases, we have tissue inhibitors of matrix metalloproteinases called as TIMs. So these two are responsible for the remodeling of the scar which has formed. Then last step will be the wound contracture. So if the wound is this large and there is a scar forming this big, so it will look bad, right? So normally we don't get that big a scar. We are going to have a very small scar. That is due to the wound contracture. So wound contracture is due to some cells called as myofibroblasts. These are nothing but fibroblasts only. They acquire some muscle property and they are called as muscle fibroblasts. So muscles are capable of contraction. So these myofibroblasts cause the wound contracture. So granulation tissue, I already mentioned, it is the hallmark of repair. It is going to be composed of new blood vessels, which is in neoangiogenesis, then fibroblasts and inflammatory cells. So inflammatory cells are usually macrophages and lymphocytes. Mostly it is M2 macrophages, and these M2 macrophages are the ones which are going to secrete fibrogenic cytokines like TGF beta, PDGF and FGF2, fibroblast growth factors. So all of this is responsible for recruiting the fibroblast, which is also a component of granulation tissue. So this fibroblast will lay down connective tissue material which is collagen. And what type of collagen? In granulation tissue, it is going to be type 1 and type 3 collagen. Remember, in granulation tissue, it is always both the types of collagen, type 1 and type 3 collagen. But as the scar matures, this collagen will be becoming into type 1 collagen. So scar tissue is type 1, granulation tissue is both type 1 and type 3. So type 1 collagen is the most abundant and also the most strongest of all the collagens. So that is what is present on the skin also, right? So type 1 collagen is the one which is present on the scar tissue, so that we have the wound strength. So day-wise events which happen in wound healing. So this is very important for MCQs again. So on the very first day or the day 0, so as soon as there is an injury, what happens? Inflammation, neutrophils will start coming, and other than that you have clot formation also, right? So initially there will be platelet plug formation and fibrin formation. So on day 1, the neutrophils will start coming into this clot. On day 2, what happens? There will be a thin epithelial layer which is forming. So if this was the gap over here, there will be a thin epithelial layer which is trying to bridge the gap first. Okay. Then on day 3, neutrophils will be replaced by macrophages, because macrophages are the chronic inflammatory cells, right? So when macrophages come, M2 macrophages, right? So M2 macrophages will have to will secrete the fibrogenic cytokines, and that will result in the early granulation tissue, which is composed of fibroblasts and blood vessels and the inflammatory cells. And this inflammatory cells will be M2 macrophages. So this fibroblasts which were present, it is going to secrete some collagen which is going to start at the margins of the wound. So this is how you have to remember it. Then day 5, what happens? This granulation tissue which was present is going to be proliferating. Lots of granulation tissue is going to be present. So maximum amount of granulation tissue is there. So granulation tissue contain blood vessels. So maximum amount of angiogenesis will also be there on day 5 only. And the collagen which is going to be laid down by this granulation tissue fibroblast is going to bridge the wound now. So the wound gap is going to be filled by this collagen, and there is also full thickness epithelium. So initially the lining was only this much, right, in this stage. So in this stage it was just a thin layer of epithelium, but in day 5 it has grown up to the entire thickness. Then on day 21, we have the maximum collagen deposition, and on day 28, the scar formation is going to be complete. So day 28, scar formation is complete. Maximum collagen composition is going to be, deposition is going to be on day 21, and maximum granulation tissue will be on day 5. Macrophages come on day 3. Okay. So this scar is going to, within 3 months of time, it is going to acquire at least 70% of the wound strength. Okay, 70% of the wound strength is going to acquired by 3 months of time. And it is never ever going to be 100%. Once it is wounded, it is never going to gain the 100% strength. The types of wound healing we see is primary or the first intention, and the secondary or the secondary union or the secondary intention. So primary intention is the one which we see in surgical scars. So there is a clean wound and there is going to be opposed edges. Only the incision site is going to be there. It is going to have opposed edges. So in secondary intention, it is usually due to trauma. So there will be gaping of the wound, and then it is going to have some kind of infection also. And with this kind of secondary union, you will have lots and lots of granulation tissue formation along with lots of scar tissue formation compared to the primary union. And the most important feature about secondary union will be wound contracture. There will be, since there is going to be a gaping wound, when it is being bridged, it is going to have to contract so that there is only a small scar tissue formation. So wound contracture is a feature of secondary union. So pathologically, what are the conditions which result in tissue repair? We have hypertrophic scar and keloid. So hypertrophic scar is nothing but a scar only which is limited to the margins, but it will usually it is kind of more than that of the normal scar tissue. So it is going to be elevated above the skin level, but it is still the margin, it is the margins of the scar is going to be limited to the scar tissue. While in keloid, it is going to extend beyond the margins of the scar. It is going to go outside of the scar as well. while hypertrophic scar is self-resolving. So within a year, it can resolve, and microscopically, if you see, there will be orderly thin collagen deposition. While in keloid, it is usually happening in susceptible individuals, usually African American origin. So usually in sites of ear piercings or even previous scar surgery, so surgical scars, again on that you will have keloid formation. So on the shoulders you can see, on the ear lobes you must have seen, or most commonly the site is the sternum. So here it is not going to resolve, it is going to continuously grow, and microscopically if you see, lots of collagen, thick bundles of collagen will be seen arranged in a Hafezat pattern. So the treatment for this keloid will not be excision, because once you are excising it, again it is going to cause some tissue injury that will result in again a scar formation and further keloid formation. So for a keloid you will have to inject hydrocortisone, which is a steroid. So in keloid you will have to inject hydrocortisone. That is how the keloid will resolve. So last topic will be neutrophil extracellular traps. So neutrophil extracellular traps, as the name suggests, the neutrophil is going to extrude some material. So what material? It is going to be the neutrophil's nuclear material. So neutrophil's nuclear material along with the granular contents of the neutrophil is going to be extruded into the external environment. So why does it happen? It is actually a mechanism of antimicrobial killing only. So these granular contents are highly antimicrobial, right? So whenever the neutrophils wants to control the spread of infection. So control the spread of infection, it is going to release this neutrophil extracellular traps, and so the infection spread will be controlled, and there is also going to be killing of the microbes. So one important thing about this neutrophil extracellular trap is, since the nuclear material is being extruded, it can act as self antigen. So the self antigens which are actually protected inside the cell are exposed to the external environment. So against this neutrophil antigens we can form auto antibodies. So auto antibodies against nuclear antigens are present. So these are going to be termed as anti-nuclear antibodies. So it can lead to certain autoimmune diseases like SLE. Okay. So many diseases have been implicated in the pathogenesis of neutrophil extracellular trap. Most of it is autoimmune diseases. So this one can come as an image based question also.